Me today. My name is Dr. Natalie Riediger. I'm an Associate Professor of Public Health Nutrition at the University of Manitoba. But most importantly, I'm here as a parent of 2 children with dyslexia who were failed by Manitoba's public education system. And I'm here in support of Bill 225. For my PhD dissertation many years ago, I utilized data from 2 diabetes screening studies with the Manitoba First Nation community, and so I have expertise with respect to screening. And I'd like to make several points relevant to my expertise in public health and screening, as well as my experiences as a parent. First, universal screening is a long-standing public health tool. Everyone in this room has been screened, probably a lot, probably more than you even know. Every baby in this province is screened at birth for phenylketonuria, a rare metabolic disorder. As we age, we are screened for many cancers. Sometimes screening is for diseases, but sometimes it isn't. For example, during pregnancy, every woman is screened for Rh factor. My blood type is ORH negative. That's not a disease. Both my babies were born Rh positive, and so I received Rh immune globulin. And this prevented me from developing antibodies against another blood type. The eradication of Rh hemolytic disease is one of Manitoba's greatest public health success stories. Screening falls under the broader umbrella of preventive medicine. This includes vaccines, nutritional fortification policies, annual physicals, and dental cleanings, among others. Universal screening is an optimal public health tool when key criteria are met. Number 1, the condition should be a significant public health problem. Failing to teach a child to read is beyond damaging. The evidence supports illiteracy as a significant public health problem. The vast majority of adverse health outcomes follow an educational gradient, such that those with lower levels of education experience worse health outcomes. Educational attainment, for example, is also the strongest predictor of diet quality. To clarify, so I don't get accused of medicalization, the problem is not dyslexia. The problem is when dyslexia remains unidentified and not accommodated, resulting in a child not meeting their full potential in literacy. A second key criteria for universal screening should be a clear, detectable early phase and benefit to early intervention. Children with dyslexia can learn to read, and the benefits of early intervention are well established. Teaching a child to read in later years takes considerably more time. It requires greater intensity and more resources than when initiated early in kindergarten. Early intervention also preserves a child's self-esteem and dignity. A third key component of universal screening is that there must be a valid, reliable, and cost-effective screening tool. There are valid screeners for reading that can identify children at risk of learning disabilities with a high degree of sensitivity in kindergarten. Sensitivity is a screening test's ability to correctly identify true positives, in this case, kids with learning disabilities. I became concerned about my son's language development at the age of 3, only to be told by both a developmental pediatrician and speech pathologist that they had no concerns. A language-based disability like dyslexia manifests early. Importantly, screening results will do so much more than just identify children's reading ability. Having valid data is a system game changer. The current lack of quality data in the education system is like flying blind with our children. Finally, you only implement universal screening when there's an established evidence-based response and plan for follow-up intervention should somebody be screened positively or screened as at risk or not meeting benchmarks. In the case of screening for reading difficulties, we know there are effective evidence-based reading instructional approaches. Indeed, my kids received them, just not in the public school system. Unfortunately, this is where the rubber meets the road. Screening and communicating with parents are the easy parts. What does a school do for a child who is struggling? Currently, not much. The much more difficult issue is the fact that Manitoba schools largely do not provide evidence-based classroom reading instruction, which will render screening less effective. Nor do many schools provide evidence-based reading interventions, which defeats the purpose of screening. Reading Recovery is a reading program that's been used for over 30 years in Manitoba for grade 1 students. This program and teacher training is associated with the use of Fontes and Pinnell benchmark assessment kits and intervention books, which are not valid assessments. Both my children were in Reading Recovery. Because thousands of teachers receive this training in Manitoba, this instruction is also in classrooms. Reading Recovery is based on a discredited approach to teaching reading called cueing, or 3-cueing. The latest research demonstrates children become worse readers when Reading Recovery is used compared to similar children who did not receive it. In other words, it's worse than doing nothing. Maybe if the system had decent data, a harmful program wouldn't have gone unchecked for 3 decades. Witnessing what Reading Recovery did to my child with dyslexia has been one of the most painful experiences of my life. I don't know if we'll ever recover from Reading Recovery. Another mother whose daughter was in Reading Recovery and later diagnosed with dyslexia described to me that she felt as though her daughter was being abused. In 2022, the landmark Ontario Human Rights Commission Right to Read report specifically stated that 3-cueing should not be used. And yet, Reading Recovery training continues to be funded in Manitoba until next year. This response tells me everything I need to know about what the education sector thinks about children with reading disabilities and their human rights. Reading about our same experiences in that Ontario Right to Read report and seeing how easily it was ignored was hurtful beyond words. One doesn't need to harbor ill intent to hurt children. The absence of empathy and understanding has been enough. The policies and narratives circulating in the education system reinforce the inferiority of children with dyslexia, their families, and the instruction they need. Our kids are called stupid, slow, lazy. The truth is, our kids are smart. They're working harder than anyone. Parents are told, "Are you reading to your kids enough?" Maybe they just need to find their Harry Potter. You should accept your child the way they are. The truth is that no amount of reading to a child with dyslexia will teach them to read. A good book is not a substitute for reading instruction and reinforces that the issue is lack of motivation. I love and accept my children. I don't accept ableism in the form of low expectations for them and harmful instruction. The instruction our kids need is often referred to as oppressive, deficit-oriented, boring, kill and drill. I don't accept these negative characterizations. The truth is, pedagogy that produces illiterate children and harms children can't be anti-oppressive, culturally responsive, or strength-based. Unfortunately, ableism precludes the very participation in democracy happening here today. How can somebody provide a written statement when no one taught you to write? It is a powerful form of social exclusion. And the oppression from the education sector towards children with learning disabilities is intense. I feel a deep responsibility as an ally in this space, as someone with an incredible amount of privilege. I'm here because of my kids, but not for them. It's too late for us, and the damage is far deeper than just years of lost reading instruction. I'm here for other people's children and families. Every child matters. They have the right to learn to read. They have a right to be screened so their needs are recognized. Dyslexic children deserve to receive a diagnosis of a learning disability with dignity, not using the current wait to fail model that robs children of their self-esteem and well-being. Families deserve to feel trust in the education system. We all deserve to feel heard. Bill 225 is a very small step in that direction, but we're not done yet. Thank you.
Thank you, Dr. Riediger. Any questions? Emily Lamoureux.
I'd like to thank you, Dr. Riediger, for coming out and presenting at tonight's committee and just sharing the information and the facts and the examples in which you have. There's a lot of new information. We've been debating this legislation now for probably close to 8 to 10 months in the House, and you raised some new points this evening, so thank you for that. I appreciate a distinction between that dyslexia is not the problem. it's not diagnosing it. And we need to be doing better at that here in Manitoba. I noticed you almost ran out of time, so I just wanted to make sure if there was anything else you wanted to convey, you had that opportunity.
Thank you, Emily Lamoureux. Dr. Riediger?
I'm okay, thank you.
Okay. Yeah, Emily Schmitz, or Minister Schmitz, sorry.
Thank you, Honourable Chair, and thank you very much, Dr. Riediger. It's nice to see you again. Thank you very much for taking the time to share not only your expertise with the committee, but also your personal experience. Thank you very much. I appreciate the health lens and that you put on this discussion, and some of the comments you've made. I can tell you as minister, there's two fundamental principles I think about when we're making any sort of policy. One is every child matters. You said that, sort of centering the best interests of the child at all of our decisions. Also, health in all policies is something I think about also, and how education really is such an indicator for health outcomes and for quality of life for all Manitobans. You also mentioned in your comments about in health we screen for things that are not necessarily disease. So I wonder, in reference to Bill 225, if you have any concerns about the fact that this bill speaks specifically about learning disabilities and doesn't talk about other learning difficulties or learning challenges, and what your comments might be in that regard.
Dr. Riediger.
Thank you for that question. And I think rooted in every child matters. I think it doesn't matter why somebody's struggling to read. I think screening is really important at identifying those children's needs regardless of why they're struggling. So I know that was a comment earlier about whether the title of this bill could be changed. I'm fine with either language. I think screening will support children beyond those who have dyslexia.
Thank you, Dr. Riediger. Emily Cook.
Hi, Dr. Riediger. Thank you for coming. And you touched on a lot in that presentation. And if I can paraphrase you, please correct me if I'm wrong, but screening is a first step, but we need to change the way we teach kids to read in schools. You talked about the pitfalls of reading recovery and the queuing system. Can you, in the brief time we have, talk about what we should be doing instead?
Yes, that's great. Structured.
Dr. Riediger. No, that's okay.
Yes, we should be changing reading instruction to what's referred to as structured literacy, and that's an evidence-based approach to reading instruction, and it really is aligned with a public health approach because you want classroom instruction to be effective for the greatest number of students, so you're not leaving anybody behind. You need to get evidence-based instruction in the classroom because ideally you want to get to like 80% of kids meeting benchmark because the system can't handle having many children needing tier 2, tier 3 instruction. And so having instruction in the classroom that's going to work for the greatest number of students is critical.
Thank you, Dr. Riediger. Any further questions? Thank you for your presentation.